Things you need to know about syphilis.
Definition: Syphilis is a bacterial infection usually spread by sexual contact. The disease starts as a painless sore, typically on your genitals, rectum, or mouth. Syphilis spread from person to person via skin or mucous membrane contact with these sores. After the initial infection, the syphilis bacteria can remain inactive dormant in your body for decades before becoming active again. Early syphilis can be cured sometimes with a single shot injection of penicillin. Without treatment, syphilis can be severely damage your heart, brain, or other organs and can be life-threatening. Syphilis can also be passed from mothers to unborn children. Etiology: Causes of the disease. The cause of syphilis is a bacterium called Treponema pallidum. The most common route of transmission is through contact with uninfected persons sore during sexual activity. The bacteria enter your body through minor cuts or abrasions in your skin or mucous membranes. Syphilis is contagious during its primary and secondary stages and sometimes in the early latent period. Factors attributing syphilis: MSM, HIV risk compensation, HIV co-infection, having multiple sex partners, practicing unsafe sex, and illicit drug use are all overlapping, contributing factors to the marked increase in the incidence of syphilis in the United States. Epidemiology: Risk factors. Common risk factors in the development of syphilis include unprotected sexual intercourse, intravenous drug abuse, men who have sex with men in healthcare occupations, multiple sexual partners, prostitution, illicit drug use, unprotected sex, men who have sex with men, residents in highly prevalent areas, HIV infection, presence of other STI, previous history of STI, intravenous drug use, healthcare professionals who are predisposed to occupational risk, low socioeconomic status. Prevalence: In 2017, a total of 30,644 cases of P&S syphilis were reported in the United States, yielding a rate of 9.5 cases per 100,000 population. Population affected: Countries like Belgium, Germany, France, and many others saw increases of over 50%. The reported rates of syphilis in European countries vary overall. The lowest reported rate was from Croatia, where 1 per 100,000 people have been infected. The highest rate reported was Denmark with 13.7 per 100,000 people infected.
Signs and symptoms of syphilis. Syphilis develops in stages and symptoms vary with each stage. But the stages may overlap and symptoms don't always occur in the same order. You may be infected with syphilis and not notice any symptoms for years. Complications of syphilis. Take note of this. Without treatment, syphilis can lead to damage throughout your body. Syphilis also increases the risk of HIV infections and for women can cause problems during pregnancy. Treatment can help prevent future damage but can repair or reverse damage that's already occurred. Small bumps or tumors called commas. These bumps can develop in your skin, bones, liver, or any other organ in the late stage of syphilis. Commas usually disappear after treatment with antibiotics. Neurological problems. Syphilis can cause a number of problems with your nervous system, including headache, stroke, hearing loss, meningitis, visual problem like blindness, dementia, loss of pain and temperature sensation, sexual dysfunction in men, and bladder incontinence. Cardiovascular problems. These may include bulging or aneurysm and inflammation of the aorta, your body's major artery, and of the other blood vessels. Syphilis may also damage heart valves. HIV infection. Adults with sexually transmitted syphilis or other genital ulcer have an estimated 2 to 5-fold increased risk of contracting HIV. A syphilis sore can bleed easily, providing an easy way for HIV to enter your bloodstream during sexual activity. Pregnancy and childbirth complication. If you're pregnant, you may pass syphilis to your unborn baby. Congenital syphilis greatly increases the risk of miscarriage, stillbirth, or your newborn's death within a few days after birth.
Enzyme immunoassay or EIA test. This blood test checks for syphilis antibodies. A positive EIA test should be confirmed with either the DDRL or RPR test. Shortly after infection occurs, the body produces syphilis antibodies that can be detected by a blood test. Even after full treatment, antibodies to syphilis remain in the blood and may be detectable for many years after the infection has gone. Classification of the disease. Primary syphilis. The first sign of syphilis is a small sore called a canker. The sore appears at the spot where the bacteria entered your body. While most people infected with syphilis develop only one canker, some people develop several of them. The canker usually develops about 3 weeks after exposure. Secondary syphilis. Within a few weeks of the original canker healing, you may experience a rash that begins on your trunk but eventually covers your entire body, even the palms of your hands and the sole of your feet. This rash is usually not itchy and may be accompanied by a wart-like sores in your mouth or genital area. Some people also experience hair loss, muscle aches and fever, a sore throat, and a swollen lymph nodes. These signs and symptoms may disappear within a few weeks or repeatedly come and go for as long as a year. Epidemiology. Latent syphilis. If you aren't treated for syphilis, the disease moves from secondary stage to the hidden or latent stage when you have no symptoms. The latent stage can last for years. Signs and symptoms may never return, or the disease may progress to the third or tertiary stage. Tertiary syphilis. About 15 to 30% of people infected with syphilis who don't get treatment will develop complications known as late tertiary syphilis. In the late stage, the disease may damage your brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. These problems may occur many years after the original untreated infection. Neurosyphilis. At any stage, syphilis can spread and, among other damage, cause damage to the brain and nervous system or the neurosyphilis, and the eye or the ocular syphilis. Congenital syphilis. Babies born to women who have syphilis can become infected through the placenta or during birth. Most newborns with congenital syphilis have no symptoms, although some experience a rash on the palms of their hands and soles to their feet. Later signs and symptoms may include deafness, teeth deformities, and saddle nose, where the bridge of the nose collapses.
Prevention of infection. Abstain or be monogamous. The only certain way to avoid syphilis is not to have abstain from sex. The next best option is to have mutually monogamous sex in which both people have sex only with each other and neither partner is infected. Avoid recreational drugs. Misuse of alcohol or other drugs can inhibit your judgment and lead to unsafe sexual practices. Use a latex condom. Condoms can reduce the risk of contracting syphilis, but only if the condom covers the syphilis source. Partner notification and preventive treatment. Prevention of infection. If test shows that you have syphilis, your sex partners, including your current partners and any other partners you've had ever the last 3 months to 1 year, need to be informed so that they can get tested. If they're infected, they can be treated. People can be infected with syphilis and not know it. In the light of often deadly effects syphilis can have on unborn children, health officials recommend that all pregnant women should screen for the disease. Official confidential partner notification can help limit the spread of syphilis. The practice also steers those at risk towards counseling and the right treatment. And since you can contract syphilis more than once, partner notification reduces the risk of getting reinfected. Screening for pregnant women. Treatment for syphilis. The preferred treatment at all stages is penicillin, an antibiotic medication that can kill the organism that causes syphilis. If you're allergic to penicillin, your doctor may suggest another antibiotic or recommend penicillin desensitization.